First, let's do a high-level review of your entire treatment spectrum for sleep apnea. This goes from less expensive to more expensive, less involved to more involved, less risky to more risky. There may be a slight exception to that, and we'll hit that in a moment. Keep in mind this is a high-level review of all treatment options. We'll circle back to this later in the presentation where you'll be able to really refine your choice and put a custom treatment plan together. Treatment option number 1, live with it. Those who decide to live with it have to accept 2 risks. The number 1 risk is that sleep apnea will shorten your life up to 10 years. How could that possibly be true? Well, let me tell you. Untreated sleep apnea leads to strokes, heart attacks, diabetes, high blood pressure, neurologic decline, including dementia, Alzheimer's, Parkinson's, and this just is a few examples. All of these things shorten your life. Well, can I just postpone this decision till later? If you do, then you may not regain all 10 years of your life. Catch it early and take action. That's a recommendation when it comes to the treatment of sleep apnea. Risk number 2 is that it ruins relationships. It can ruin relationships with your spouse, significant others, family members, coworkers. They may not like you as much as they should. Treatment option number 2 is behavior modifications. Now we're transitioning from our least favorite, live with it, to our most favorite, behavior modifications. For those of you who are really engaged, we can help you to put together a plan. You need to have a healthy diet, exercise, weight loss. For those of you who could benefit from positional changes, in other words, sleeping in certain positions, we'll talk to you about that. Sleep hygiene, where you go to sleep at the same time and you create a very good environment with no electronics. Clear your nasal airway. Once you've done those 6 behavior modifications, we could repeat your sleep test and see how much better you get. However, we need you to really commit, and we need to see you back in a 3 and 6 month period of time to see how much you improved. I'm going to skip over the oral appliance and move up to the CPAP. We'll come back to the oral appliance in just a moment. The CPAP, the benefit is that there's immediate availability. Unfortunately, there are some hidden costs, and that comes in the form of buying supplies that have to be replenished every so many months. There's also the energy and the cost of cleaning the device. It can be somewhat inconvenient for people who enjoy traveling and want to fly in an airplane or visit friends and family. They'll have to drag it with them. There could also be issues with intimacy where it's hard to hold your spouse when you're wearing something so unromantic. Finally, you need to be aware that there is a risk of cancer. About half the devices have been recalled previously because they were proven to cause cancer. The others, we don't know, but we are unaware of that. So right now, the verdict is still out. Surgery. Well, surgeries involve the nasal airway, and the airway does begin with the nose. If you sleep with your mouth open at night, you really need to address that as a higher priority. Tonsillectomy. Uveal palatal pharyngoplasty is cutting the back of your soft palate away. This is something we really do discourage. Tracheostomy is putting a hole in your trachea. The Inspire treatment is where you put a probe into your neck on a nerve and it stimulates the nerve over and over again. The long-term consequences of this are yet to be described. There's many other surgical options. Finally, we have the oral appliance. This is lower cost than the CPAP or the surgery. This offers lifestyle benefit in that you could simply travel by throwing this in your travel case and off you go. You can hold your spouse when you go to sleep at night, and people don't need to see strap marks on your face the next day. Because of the ease of use and the ease of care, we have a higher success rate with people using their oral appliance. But you do need to have healthy teeth. If you do not have healthy teeth, you should probably shy away from this treatment option.